The OPM.
We're over
it.
Poverty. What is it? Who is in it? And how does it look from country to country?
These are just a few questions people begin to ask themselves when thinking about ways to alleviate poverty.
We'll give a history of common poverty definitions and measures of poverty and show why they are insufficient, while introducing a model that we think will be more conducive to helping those in need.
Poverty is most widely understood as income deprivation. This means having an inadequate amount of income to comfortably obtain the goods and services one needs.
Currently, the United States uses an income threshold system to describe who is in poverty. Those who fall below a predetermined monetary line are thus considered impoverished.
So how are those poverty thresholds determined? The most common measurement of poverty in the United States is the official poverty measure, or the OPM for short.
The OPM is calculated from an income perspective based on biological basic needs. It compares pre-tax income to a threshold determined by the cost of a monotonous yet nutritious diet multiplied by 3, as food was thought to be 1/3 of the cost of a family's expenses. The OPM was developed in the 1960s and is based solely on the cost of food.
This is misleading, as food costs have shifted from accounting for 1/3 of a typical household's expenses to making up for around 1/6 of a typical household expenses.
The measure also fails to account for geographic location, which ultimately compares workers living in rural and urban areas as if their living costs are equivalent.
There is, however, a more modern approach to measuring income-based poverty. The supplemental poverty measure tries to address some of the issues with the OPM by including in-kind benefits such as SNAP and housing credits, as well as near-cash benefits such as tax credits. The SPM provides a more accurate picture of a household's true financial status. The SPM also takes into account geographic location on the cost of living.
Although the SPM is a huge improvement from the OPM, it still views poverty as simply income deprivation. Philosopher Martha Nussbaum challenges our measurement of poverty by saying that we define poverty by income simply because it's the easiest factor to measure. Income is relative. It means something different across space and time. Someone can work full-time at the same pay grade and be comfortable in one city and nearly homeless in another.
Income itself is not actually what we care about. In truth, we're only concerned with income because it's a means to achieve other outcomes, such as purchasing the goods or services we need to fulfill our capabilities.
Philosopher and economist Amartya Sen offers a solution of defining poverty as deprivation in the capability to live a good life.
We are not disillusioned with the amount of controversy that exists over what constitutes a good life, but Martha Nussbaum's list of capabilities offers a good starting point. We've condensed the list to account for cross-cultural application.
Life and longevity.
Bodily health and physical integrity includes general good health. This is reproductive health, relaxation and leisure, as well as security against violent assault or sexual assault.
Emotions, imagination, thought, reason. Being able to use the senses. Engage in critical reflection about the planning of one's own life.
Affiliation and cohabitation is the ability to cohabit communities with others, to recognize and show concern for other human beings and other species.
Over one's environment. Political control, being able to participate effectively in the political sphere of one's life. Material control, having a way to obtain the means to a good life, in most cases income, but not exclusively.
Our proposed system of gathering accurate information about poverty draws upon the Human Development Index. The HDI attempts to measure the fulfillment of health, education, and economic status. These are 3 essential components to our previously defined list of capabilities.
The HDI is widely used across the globe, but looks at nations as a whole rather than on the individual level that we're interested in. We imagine these measurements could be applied on a more local level, showing the health, education, and economic averages by state. A threshold would be determined to designate whether or not one is living in poverty. We will use the same common mathematical models that HDI employs. Gathering this information will involve a synthesis of government-collected information such as tax and healthcare records, as well as information gathered by the CDC and the Department of Education.
This threshold is much more accurate than that of the OPM in showing the quality of people's lives. To determine the actual poverty measures, comparing the achievements of those who fall below the threshold will show what capabilities individuals have not yet fulfilled. This comparison could be done in a number of ways, but we think that by administering a simple survey to those who fall under the threshold statistically would give them the chance to indicate what capabilities they feel like they do not have. This information could be used then by welfare programs. Some may think that this new measurement of poverty would be a significant extra cost to taxpayers. Because all of the information the HDI uses is already collected by government organizations, there would be no extra cost in determining this new threshold. The self-reporting system, however, could be an additional cost. However, this survey would serve to phase out and replace the OPM, potentially negating any additional cost.
This assumption of costs also stems from the common misconception that measuring poverty and funding welfare programs are the same thing. But that is inaccurate, as we explained in our summary of the OPM. Programs to alleviate poverty are a separate entity from measuring it.
We do understand that some may not agree with the way we have defined these capabilities. However, we have not encountered any arguments against them as being a net negative on people's lives.
Measuring these interpersonal issues is often difficult. Someone may not know necessarily what they need or what could potentially be offered to them, so the self-reporting system we propose may be somewhat flawed. In short, people might not know their own capabilities. Filling out the survey would also require them to be literate and have a mailing address. We believe these things can be accounted for, as the survey could be administered and translated within public organizations such as libraries, Department of Motor Vehicles, or police stations.
We believe that everyone has a personal interest in alleviating poverty. According to Rawls, rational contractors would adopt a policy to ensure that the bottom group has the highest means possible. Increasing the well-being of our worst-off citizens will improve the overall well-being of our economy.
More adequate measurements of poverty offers the opportunity for better programs to alleviate it. Less people in poverty means a more productive society, as it allows people to pursue jobs and hobbies that bring long-term economic and personal gains for us all.